What if I told you the healthcare system was designed to keep you sick, billions in profits, while patients go bankrupt just trying to survive? Big pharma, insurance giants, hospital corporation, they don't want you to see this. Today, I'm exposing the hidden truth about money in medicine, how Wall Street runs healthcare, how the system is rigged against you. This is patience versus profits, and you deserve to know the truth. By the end of this video, you'll understand why everything costs so much and why they've been lying to you all along. Let's begin. But first, make sure you subscribe. This information needs to spread.
Did you know that while you're lying in a hospital bed fighting for your life, someone on Wall Street is calculating the yield on your suffering? You are not a patient. You are collateral. And by the end of this video, you'll understand exactly how this happened, who designed it, and why it works exactly like organized crime. I'm not talking about pharmaceutical companies selling you overpriced medication or insurance corporations denying your claims. I'm talking about something far more insidious, something that operates in the shadows of the financial system, turning your illness into a tradable asset and your medical debt into profitable securities. This isn't conspiracy theory. This is the architecture of modern healthcare finance, and it's happening right now to millions of Americans who have no idea they've become collateral in a game they never agreed to play. Picture this. You walk into a hospital because you need emergency care. You're scared, vulnerable, maybe even fighting for survival. But while doctors are treating you, there's an entirely different operation happening behind the scenes. That hospital you trust? There's a good chance it was bought by a private equity fund or a financial institution that views healthcare not as a mission to heal, but as an opportunity to extract maximum profit. These aren't traditional hospital administrators making decisions based on patient outcomes. These are Wall Street executives implementing protocols designed to generate revenue streams, optimize billing practices, and yes, create debt that can be packaged, securitized, and sold to investors looking for returns. Your body, your health crisis, your financial devastation becomes their quarterly earnings report. And the worst part? You didn't consent to any of this. Here's where it gets even darker. Those medical bills that arrive months after your treatment, filled with mysterious charges you don't understand. That debt you can't possibly pay. It doesn't just sit there. It gets bundled together with thousands of other people's medical debt and transformed into financial instruments traded on secondary markets. Think of it like an auction house for human suffering. Investors buy these debt portfolios for pennies on the dollar, then pursue collection with ruthless efficiency. The sicker you get, the more procedures you need, the longer you stay in the hospital, the more valuable you become as an asset class. This is financialization of human suffering operating at industrial scale. And this isn't some distant abstract problem affecting other people in other places. Right now, as you're watching this, approximately 66% of personal bankruptcies in the United States are linked to medical debt. Families are losing their homes because someone got cancer. Young people are starting their adult lives buried under six-figure medical bills from a single emergency. People are rationing insulin, skipping treatments, and literally dying because they're terrified of the financial consequences of seeking care. You might think you're safe because you have insurance, but the system is designed with trapdoors and surprise billing practices that can financially destroy even the well-prepared. Have you or someone you know been caught in this trap? In the next few minutes, I'm going to show you exactly how this system works, who's profiting from it, and why it operates using the exact same playbook as organized crime. You're going to see how hospitals became profit centers, how your medical records became data points in a yield calculation, and how the people orchestrating this scheme have insulated themselves from accountability while millions suffer. What you're about to discover will fundamentally change how you view the healthcare system. And once you see it, you can't unsee it. So here's what's really happening behind those sterile hospital walls. The architecture of this scheme starts with something deceptively simple: acquisition. Over the past 2 decades, private equity firms and investment funds have been systematically buying up hospitals, emergency rooms, physician practices, and entire healthcare systems across America. They're not doing this because they suddenly developed a passion for medicine or public health. They're doing it because they've identified healthcare as one of the last remaining sectors where captive customers have no choice but to pay whatever price is demanded. When you're having a heart attack, you don't shop around for the best deal. When your child needs emergency surgery, you don't negotiate terms. This lack of consumer choice creates what Wall Street calls pricing power. And in the healthcare sector, that power is absolute. So what happens once these financial entities take control? They implement what they euphemistically call operational efficiency. In practice, this means maximizing revenue extraction from every patient encounter. Hospitals that were once run by medical professionals focused on patient outcomes are now managed by executives whose bonuses are tied to EBITDA margins and quarterly performance metrics. The incentive structure gets completely inverted. Instead of rewarding doctors for keeping people healthy, the system rewards them for ordering more tests, performing more procedures, and extending hospital stays. Every additional night you spend in that bed, every extra scan they run, every specialist consultation generates billable events that feed into the revenue stream. Your illness becomes inventory, your treatment becomes a profit center, and your inability to pay becomes the foundation for the next phase of the extraction. This is where it gets truly diabolical. When you receive that hospital bill you can't afford to pay, that debt doesn't disappear. The hospital or healthcare provider sells that debt, usually for a fraction of its face value, to specialized debt buyers or collection agencies. But here's what most people don't know. Those individual debts get aggregated into portfolios worth millions or even billions of dollars, and those portfolios get securitized. That means they're packaged into financial products that can be traded on markets, just like mortgage-backed securities or corporate bonds. Remember 2008. Same playbook, different victims. Investors buy these medical debt securities expecting a certain rate of return based on collection rates and interest accumulation. The more aggressive the collection practices, the higher the yield. Your financial ruin is quite literally someone else's investment return. If this is making your blood boil right now, if you're sitting there thinking about your own medical bills or someone you love who got destroyed by this system, drop a comment below and tell me your story. Have you been hit with surprise medical bills? Have you had to choose between treatment and bankruptcy? Your voice matters here, and sharing your experience helps other people realize they're not alone. Hit that like button, because it genuinely helps this message reach more people who need to understand what's happening. The algorithm doesn't care about truth, it cares about engagement. So every like, every comment, every share is a small act of resistance against a system that prefers you stay ignorant and compliant. If you're realizing that this pattern of financial predation shows up everywhere, from healthcare to housing to education, subscribe, because we're going to keep pulling back the curtain on how money and power actually work in this country. Now, here's where the parallels to organized crime become impossible to ignore, and this is what makes the healthcare financialization scheme so perfectly aligned with everything else we've covered on this channel about Wall Street operating as a criminal enterprise. Think about how certain organizations operate when they want to control a market. They identify a need, create dependency, establish control, and then extract payment under threat of consequences. Protection rackets work because the victim has no alternative. You pay, or something bad happens. The brilliance, if you can call it that, is in making the victim feel like they have a choice, when in reality, the system is designed to leave them with none. Now apply that exact framework to healthcare finance, and you'll see why the parallels to predatory enterprise become so striking. The only difference is that one operates outside the law and the other has successfully lobbied to make their practices completely legal. Let me walk you through the transformation step by step, because understanding the mechanics is crucial to recognizing how deeply calculated this exploitation really is. It starts with the acquisition phase, which most people never even notice happening. A private equity firm or investment fund identifies a healthcare system, maybe a regional hospital network or a chain of urgent care clinics, and they make an offer the current owners find difficult to refuse. These aren't hostile takeovers in the traditional sense. The selling parties often believe they're doing the right thing, bringing in sophisticated financial management to modernize operations and improve efficiency. The language used in these transactions is deliberately sanitized. Optimization, streamlining, best practices, operational excellence. It all sounds so reasonable, so necessary, so aligned with progress. But here's what actually happens once the financial entities take control. The first priority is implementing what they call revenue cycle management, which is corporate speak for extracting maximum payment from every patient interaction. This means hiring consultants who specialize in medical billing codes, identifying opportunities to upcode procedures, training staff to document in ways that justify higher reimbursement rates, and implementing protocols that increase the volume of billable events. A patient who walks in with a simple complaint might suddenly find themselves subjected to a battery of tests, not because medical necessity demands it, but because each test generates a separate charge. Emergency room visits that could be resolved in 2 hours stretch into 6 or 8, because keeping that bed occupied longer creates more billing opportunities. Doctors who once had autonomy over treatment decisions now face pressure from administrators to meet productivity metrics that have nothing to do with patient outcomes and everything to do with revenue targets. Does this sound like healthcare to you? Or does it sound like something else entirely? The impact on actual medical care is devastating, but that's almost beside the point for the financial architects of this system. They're not trying to improve health outcomes. They're trying to maximize cash flow and create predictable revenue streams that can be leveraged for further financial engineering. Traditional hospital administration, for all its flaws, operated under a framework where patient care was at least theoretically the primary mission. Financial sustainability mattered, but it existed in service of the healing function. Under financialized healthcare, that relationship inverts completely. Patient care becomes a means to financial extraction. The human being in the hospital bed transforms from a person needing help into a revenue-generating unit whose value is measured in billable procedures and collectible debt. Now, this is where the true architecture of the scheme reveals itself. All those inflated bills, all those surprise charges, all those procedures that may or may not have been medically necessary create a mountain of debt that patients can't afford to pay. In a rational system, this would be recognized as a crisis demanding correction. In our system, it's recognized as an opportunity. The healthcare providers sell these debts to collection agencies and debt buyers, typically for somewhere between 4 and 15 cents on the dollar. At first glance, this looks like the healthcare provider is taking a massive loss. But remember, they've already inflated the charges to absurd levels, so even selling at a steep discount still represents profit on the actual cost of care. The debt buyers, though, they're playing a completely different game. They acquire these portfolios of medical debt knowing that even if they only successfully collect on a fraction of what's owed, they'll make enormous returns on their initial investment. But here's where it gets truly sinister. These debt portfolios don't just sit in filing cabinets waiting for collection calls. They get securitized, packaged into financial instruments that can be sold to investors seeking yield. The structure mirrors mortgage-backed securities, the same financial products that triggered the 2008 crisis. Thousands of individual medical debts get bundled together, sliced into tranches based on likelihood of collection, and sold to pension funds, hedge funds, insurance companies, and other institutional investors. The perverse incentive structure becomes crystal clear once you see this full picture. The more people who get sick, the more debt gets generated. The more debt gets generated, the more securities can be created. The more securities get created, the more investors profit. Every step of this chain depends on human suffering and financial devastation. Your medical crisis becomes their quarterly earnings. Your bankruptcy becomes their yield calculation. Your choice between medication and rent becomes their investment return. Let that sink in for a moment. This isn't an accident or an unfortunate side effect of an otherwise well-intentioned system. This is the system functioning exactly as designed. The architects of healthcare financialization looked at the American population and saw a captive market with predictable needs, limited alternatives, and no real power to refuse participation. The threat isn't physical, it's medical bankruptcy and ruined credit and the prospect of dying because you can't afford treatment. They've weaponized your survival instinct against your financial stability, and they've built legal and regulatory frameworks that protect their right to do exactly that. If you're finally seeing how this game works, drop a comment and let me know. Now I want to go even deeper into this subject, because understanding the system is one thing, but recognizing the actual people profiting from it and the real human beings getting destroyed by it brings this whole revelation into sharp focus. Every scheme needs its players, and this one has a cast of characters operating at different levels of the extraction pyramid. At the top, you've got the architects, the financial masterminds who designed this machinery and continue to refine it for maximum efficiency. These are the private equity firms and investment funds with names you might recognize if you follow financial news, entities managing billions of dollars in assets who've identified healthcare as what they call a recession-proof investment opportunity. And they're not wrong about that assessment. People get sick regardless of economic conditions. Medical emergencies don't wait for bull markets. This predictability makes healthcare an incredibly attractive sector for financial engineering. Some of these firms operate dozens of hospitals, hundreds of urgent care centers, thousands of physician practices across multiple states. They've built healthcare empires that generate billions in annual revenue, and their executives collect compensation packages that would make your head spin. We're talking about individuals earning tens of millions of dollars annually by optimizing the extraction of wealth from sick people. They don't describe it that way in their investor presentations, of course. They talk about operational improvements, cost efficiencies, strategic acquisitions, market positioning. But strip away the corporate language and what you're looking at is a business model built entirely on maximizing the financial damage inflicted on vulnerable populations. These aren't cartoon villains twirling mustaches and cackling about human suffering. They're sophisticated financial professionals who've convinced themselves that what they're doing is simply smart business, that they're bringing necessary discipline to a bloated and inefficient sector, that profit and patient care can coexist harmoniously. The mental gymnastics required to maintain that worldview while watching millions of Americans face medical bankruptcy is genuinely impressive in its own dark way. But the architects couldn't build this system alone. They need facilitators. First, you've got the political class, the legislators and regulators who've systematically dismantled protections and oversight that might have prevented healthcare from becoming a purely financial product. These politicians receive campaign contributions from healthcare and financial industry lobbyists. They attend fundraisers hosted by private equity executives, and when they leave office, they often land consulting positions or board seats with the very companies they were supposed to be regulating. The revolving door between government and industry isn't a bug in the system. It's a core feature. When you see legislation that makes it harder to sue for medical malpractice, or regulations that allow surprise billing, or laws that prevent Medicare from negotiating drug prices, you're watching the facilitators do their job. They create the legal framework that allows predatory extraction to operate not just with impunity, but with official sanction. Then you've got the executive layer, the hospital administrators and healthcare system CEOs, who implement the ground-level policies that make this extraction possible. These are people who might have started their careers with genuine intentions to improve healthcare delivery, but who've been shaped by incentive structures that reward financial performance above all else. Their bonuses are tied to EBITDA margins and revenue growth. Their career advancement depends on hitting quarterly targets. They face constant pressure from the financial entities that own their organizations to find new ways to increase billing, reduce costs, and maximize collections. Some of them probably feel conflicted about the decisions they're making. Others have fully internalized the logic that efficient business practices benefit everyone in the long run. But regardless of their internal justifications, they're the ones who actually enforce the protocols that transform human beings into revenue streams. And then there are the victims. Think about this for a moment. Think about the single mother diagnosed with breast cancer who has to choose between aggressive treatment that might save her life or keeping her home and financial stability for her kids. Imagine the young person, maybe 25 years old, who has a severe accident and wakes up to discover they're now saddled with $200,000 in medical debt before they've even started their career. Consider the elderly couple who've saved carefully their whole lives, only to watch decades of accumulation evaporate in a single extended hospital stay. These aren't edge cases or rare exceptions. Medical debt is the leading cause of personal bankruptcy in America, accounting for 66% of all bankruptcy filings. That's not a statistical anomaly or an unfortunate side effect of an otherwise functional system. That's the system working exactly as designed, transferring wealth from vulnerable populations to financial entities at the moment of maximum desperation. The psychological impact of medical debt goes far beyond the financial numbers. People describe feeling ashamed, like they've somehow failed by getting sick. They talk about the constant anxiety of collection calls, the humiliation of having to negotiate payment plans for life-saving care, the impossible decisions about which bills to pay and which medications to skip. Some avoid seeking medical attention altogether because they're terrified of the financial consequences, letting conditions worsen until they become life-threatening emergencies that cost far more to treat and generate even more debt. The system creates a vicious cycle where fear of medical debt leads to delayed care, which leads to more severe illness, which leads to catastrophic debt, which reinforces the fear. And throughout this entire process, the financial mechanisms keep churning, converting human suffering into investment returns with cold mechanical efficiency. What makes this whole architecture so particularly cruel is that it preys specifically on moments of vulnerability when people have the least power to resist or negotiate. You can't comparison shop for cardiac surgeons while you're having a heart attack. You can't refuse treatment for your child's meningitis because the hospital won't tell you the price up front. The entire medical system is structured around life or death urgency, and the financial extraction system has weaponized that urgency to eliminate any meaningful consumer choice or market discipline. If you've seen this pattern destroy someone you care about, or if you've lived through it yourself, I want to hear from you. Tell me your story in the comments. The parallels between organized crime and financialized healthcare aren't metaphorical or exaggerated for dramatic effect. They're structural, operational, and philosophical. When you study how criminal enterprises function, you see a consistent playbook. Identify a captive market, eliminate alternatives, inflate prices beyond any rational relationship to cost, use the threat of consequences to ensure compliance, and insulate the operation through layers of complexity and legal protection. Now look at how modern healthcare finance operates in America, and tell me you don't see the exact same strategy being executed with surgical precision. The only meaningful difference is that the mafia operates outside legal frameworks, while Wall Street has successfully captured the regulatory apparatus to make their extraction not just legal, but protected by law. Let me give you some concrete examples that make this connection impossible to dismiss. Take insulin, a medication that millions of Americans need to survive. The actual cost to manufacture insulin is somewhere between $2 and $6 per vial. That's the production cost, the raw materials and processing required to create this life-saving medication. In the United States, that same vial of insulin can cost $300 or more at the pharmacy. We're not talking about a reasonable markup to cover research, distribution, and profit. We're talking about a 50-to-1 price inflation on a product people will literally die without. And here's what makes this criminal in everything but legal status. Diabetics can't negotiate. They can't refuse to buy. They can't substitute a different product. Either they pay whatever price is demanded or they face serious medical complications and potentially death. That's not a transaction between willing parties. That's coercion dressed up as commerce. But that's not even the most cynical part of this system. Consider surprise billing, one of the most perfectly designed scams in the entire healthcare extraction architecture. You need emergency surgery, so you go to an in-network hospital. You verify your insurance coverage. You do everything you're supposed to do to protect yourself financially. Then 6 weeks later, you get a bill for $20,000 because the anesthesiologist who worked on you wasn't in your insurance network, even though you had no way of knowing that and no ability to choose a different provider while you were unconscious on an operating table. The hospital was in network, but individual doctors working in that hospital can operate as independent contractors who don't accept your insurance. Nobody tells you this beforehand. Nobody gives you a choice. You just wake up to financial devastation after the fact. If a used car dealer pulled this kind of bait and switch, they'd face fraud charges. In healthcare, it's standard operating procedure, and it generates billions in additional revenue annually. Now pay close attention, because this next part reveals how deep the predatory mindset really goes. The debt collection practices expose the criminal mentality more starkly than anything else. Medical debt buyers purchase portfolios of unpaid bills for 4 to 15 cents on the dollar, as I mentioned earlier. They're acquiring this debt at a massive discount because they know most of it will never be collected. But here's the key. They don't just write off the uncollectible portion and move on. They pursue collection on the full face value of the debt plus interest and fees. So they buy your $10,000 medical debt for maybe $800, then they sue you for $12,000 after adding their collection costs and interest charges. If you can't pay, they get a judgment against you, garnish your wages, put liens on your property, destroy your credit score. The impact on your life is catastrophic, while they're still making enormous returns, even if they only successfully collect on a fraction of their portfolio. This is exactly how loan sharks operate, except loan sharks don't have access to the court system to legally enforce their collection efforts. The transformation in mindset required to execute this strategy reveals something profound about how financial capitalism has evolved. Traditional business models involved creating value that people wanted to buy. You made a better product, you delivered superior service, you competed on quality and price. But extractive business models flip that entire framework. Instead of creating value, you're capturing it from populations that have no ability to refuse participation. You're not competing in a market, you're exploiting a monopoly position. And healthcare represents the ultimate captive market because the alternative to participation isn't just going without a luxury item, it's suffering and death. Once you recognize that dynamic, the business model becomes absurdly simple. Maximize prices, minimize alternatives, use every available tool to force payment, and hide the mechanics behind enough complexity that victims can't easily identify what's happening to them. This is why I keep emphasizing that Wall Street hasn't just adopted techniques from organized crime. They've actually perfected them. The mafia had to operate in the shadows, always risking prosecution and imprisonment. They faced moral condemnation from society and active opposition from law enforcement. Wall Street executives implementing these same strategies face none of those constraints. They operate in broad daylight. They're celebrated in business schools and featured on magazine covers. They lobby successfully to prevent regulatory interference and donate to political campaigns that ensure favorable policy environments. When their schemes cause widespread harm, they face civil penalties at worst, paid from corporate accounts as a cost of doing business, while the individuals responsible walk away with their fortunes intact. The difference between a mobster and a private equity healthcare executive isn't moral or operational. It's just that the executive has successfully legalized the racket and convinced society that what they're doing is legitimate business rather than organized theft. And the revelations keep getting worse the deeper you examine this system, because every layer you peel back exposes another mechanism of extraction, another avenue of exploitation, another innovation in predatory finance. What makes it especially insidious is that the complexity itself serves as camouflage. Most people looking at their medical bills don't understand the billing codes, can't decipher the explanation of benefits from their insurance company, have no idea how their debt might be securitized and sold. That confusion is weaponized against them. The more complicated the system, the harder it is to identify where the theft is occurring and who's responsible for it. But once you understand the architecture, once you see how all these pieces fit together into a coherent extraction machine, the truth becomes undeniable. And once you see it, you can't unsee it. If this video helped you understand something you couldn't put into words before, share it with someone who needs to hear this. The true cost of this system extends far beyond individual medical bills and personal bankruptcies. What we're witnessing is a cascade of consequences that's fundamentally reshaping American society in ways most people don't fully recognize because they're looking at their own immediate crisis rather than the broader structural damage. When you zoom out and examine the aggregate impact, you start to see that this isn't just a healthcare problem or a financial problem. It's a civilizational problem that's quietly dismantling the foundations of a functional society while the architects count their profits. Remember at the beginning of this video when I told you the healthcare system was designed to fail you? This is where that truth becomes undeniable. Start with the most immediate and obvious consequence. People are avoiding medical care because they're terrified of the financial devastation that might follow. Studies show that nearly half of Americans have delayed or avoided medical treatment due to cost concerns. That's not people skipping elective cosmetic procedures. That's people ignoring chest pain, putting off cancer screenings, rationing insulin, skipping doses of critical medications, letting infections progress because they can't afford the doctor visit. Do you know someone who's done this? Have you done this yourself? The downstream health effects are catastrophic. Conditions that could be treated easily and inexpensively in early stages become life-threatening emergencies, requiring intensive intervention. A routine checkup that might have caught high blood pressure gets skipped, leading to a stroke that costs hundreds of thousands to treat and leaves permanent disability. A suspicious lump that should have been biopsied immediately gets ignored for months until it's metastatic cancer requiring aggressive chemotherapy. The financial system designed to extract maximum revenue from illness is actually creating more severe illness, which in turn generates even more revenue. It's a death spiral masquerading as healthcare. Let that sink in for a moment. The public health implications should terrify anyone paying attention. We're watching the systematic deterioration of population health driven entirely by financial barriers to care. Life expectancy in the United States has been declining, an almost unprecedented phenomenon in developed nations during peacetime. Maternal mortality rates are rising. Infant mortality remains higher than in dozens of other countries. Preventable diseases are making comebacks because people can't afford vaccinations or basic preventive care. This isn't happening because American medicine lacks technical capability or scientific knowledge. It's happening because we've built a system where accessing that capability and knowledge requires financial resources that millions of people simply don't have. The medical infrastructure exists, the trained professionals exist, the treatments exist, but they're locked behind paywalls that large segments of the population cannot cross without risking complete financial ruin. Now expand the lens further and look at what this does to economic inequality. Healthcare has transformed from a basic human need into a luxury good accessible primarily to those with significant financial resources. If you're wealthy, you get preventive care, early intervention, access to specialists, cutting-edge treatments. If you're poor or even middle class, you get emergency rooms when things become life-threatening, and then decades of debt afterward. What would happen to your family if you got seriously sick tomorrow? This creates a health divide that mirrors and reinforces every other dimension of inequality in American society. The wealthy live longer, healthier lives with access to care that keeps them productive and active. The poor die younger, suffer more disability, lose more work time to illness, and pass health problems down to their children who grow up in households stressed by medical debt and lacking resources for proper nutrition or health care. Each generation, the gap widens. Wealth concentrates further at the top while the bottom gets squeezed harder, and healthcare extraction is one of the primary mechanisms driving this divergence. The macroeconomic impact gets even more disturbing when you consider where money is flowing. American families are collectively spending hundreds of billions of dollars annually on medical debt service, money that's going toward interest payments and collection fees rather than productive economic activity. That's money not being spent at local businesses, not being saved for retirement or education, not being invested in starting companies or buying homes. It's pure extraction, wealth being siphoned from the productive economy into financial instruments that generate returns for investors while creating nothing of value. The velocity of money slows down because cash that would circulate through communities multiple times gets captured and sequestered in financial portfolios. Small businesses suffer because potential customers are drowning in medical debt. Housing markets stagnate because young people can't save for down payments when they're paying off emergency room visits. The entire economy operates below its potential because a parasitic financial system is draining resources that could fuel growth and prosperity. And then there's the political dimension, which might be the most corrosive consequence of all. The entities profiting from healthcare extraction have enormous financial resources to deploy in protecting and expanding their business model. They fund political campaigns. They employ armies of lobbyists. They finance think tanks and academic research that produces favorable conclusions. The politicians who could reform this system are often the same ones receiving contributions from the industries that would be threatened by reform. Regulatory agencies that should be protecting consumers end up staffed by former industry executives who maintain relationships with their old employers. The revolving door spins, the influence flows, and the system becomes increasingly entrenched against any meaningful challenge. Democracy theoretically gives citizens power to demand change. But when the entities benefiting from the status quo have such overwhelming financial advantages in shaping political outcomes, that theoretical power becomes largely illusory. The concentration of wealth enabled by healthcare extraction translates directly into concentration of political power, which then gets used to prevent reforms that might interrupt the extraction. It's a self-reinforcing cycle that makes the system progressively harder to change, even as its harms become more obvious and severe. Now here's where this gets personal. The human cost shows up in statistics that should shock anyone with a functioning conscience. Millions of Americans are rationing medications, taking partial doses, or skipping days to make prescriptions last longer. People are dying from rationing insulin, a medication that costs dollars to produce. Others are forgoing treatments for chronic conditions, watching their health deteriorate in slow motion because they can't afford the care that might stabilize their situation. The mortality rate from preventable causes in the United States far exceeds that of comparable nations, representing tens of thousands of deaths every year that wouldn't happen in systems where financial barriers to care didn't exist. And behind each of those statistics is a human being, a family, a community dealing with loss that was entirely avoidable if we had decided collectively that health was more important than investment returns. If you've ever felt alone in this fight, I want you to know you're not. Leave a comment and tell me your story. We deserve better than this. After laying out all this darkness, all this exploitation, all this systematic cruelty, I know the natural response is to feel overwhelmed, maybe even hopeless. If this seems unfair to you, if it makes your blood boil, you're not crazy. You're paying attention. But here's the truth that the architects of this system don't want you to understand. They're only as powerful as our collective ignorance and isolation allow them to be. The moment people start connecting the dots, recognizing the patterns, and organizing around this knowledge, the entire structure becomes vulnerable. Resistance is already happening, alternatives already exist, and pathways forward are clearer than the system's beneficiaries would ever want you to believe. There are organizations right now engaged in what might be the most beautifully subversive form of economic resistance I've ever encountered. They're buying medical debt portfolios on the secondary market at those same pennies on the dollar prices that collection agencies pay. And then instead of pursuing collection, they're simply forgiving the debt entirely. They're using the system's own mechanics against it, turning medical debt from an instrument of extraction into an opportunity for liberation. For every $100 they raise, they can eliminate thousands of dollars in medical debt, instantly changing the trajectory of families who were drowning in obligations they could never repay. It's a direct intervention that bypasses the political gridlock and bureaucratic complexity, just straight up purchasing freedom for people trapped in financial purgatory. The scale is still relatively small compared to the trillions in outstanding medical debt, but the model proves something crucial. The system's power is not absolute, and creative resistance can exploit its own vulnerabilities. Now, before you think what I'm about to say is some utopian fantasy, hear me out. Looking beyond American borders reveals even more encouraging truths about what's actually possible when societies make different foundational decisions about healthcare. Dozens of countries have implemented universal healthcare systems where access to medical care is treated as a fundamental right rather than a commodity to be bought and sold. These aren't failed experiments or theoretical proposals. They're functioning realities in nations across Europe, Asia, and elsewhere. People in these countries don't face bankruptcy from medical emergencies. They don't ration insulin or skip cancer screenings because of cost. They don't live with the constant background anxiety that getting sick might mean financial ruin for their entire family. And contrary to the propaganda you'll hear from defenders of the American system, these countries haven't collapsed into socialist dystopias. Many have more dynamic economies, better health outcomes, longer life expectancies, and higher levels of citizen satisfaction with their healthcare systems than we do. The evidence is overwhelming that alternative models not only work, but actually deliver superior results at lower costs. The only reason we're told these alternatives are impossible is because acknowledging their success would threaten the profitability of the extraction system. This isn't about left versus right. This is about whether we accept being exploited or not. Transformation starts with transparency, with ripping away the deliberate complexity that obscures how this system actually functions. When hospitals are forced to publish their prices, when insurance companies have to disclose their denial rates, when private equity ownership of healthcare facilities becomes public knowledge, when the connections between political donations and favorable legislation are mapped and exposed, the system loses its camouflage. Information becomes a weapon against exploitation. This is why investigative journalism focused on healthcare finance matters so much. Why grassroots organizations tracking medical billing practices and pharmaceutical pricing are doing crucial work. Why every person who shares their medical debt story publicly is contributing to a collective awakening. The more people understand exactly how they're being exploited and who's profiting from their suffering, the harder it becomes for the system to maintain legitimacy. On an individual level, there are specific actions that can provide some protection even within this broken system. Learning to scrutinize medical bills for errors, understanding your rights regarding debt collection, knowing how to negotiate payment plans, being aware of financial assistance programs that hospitals are often required to offer but rarely advertise. These practical skills can mean the difference between manageable hardship and total financial devastation. It's not fair that people need to become amateur experts in medical billing and debt law just to avoid being destroyed by healthcare costs. But until the system changes, that knowledge is genuine power. Similarly, supporting political candidates and policies that would regulate healthcare pricing, expand public healthcare options, or otherwise challenge the extractive model represents a longer-term investment in systemic change that benefits everyone. The vision of what's possible should drive our sense of urgency around this issue. Imagine a healthcare system where treatment decisions are made based purely on medical necessity rather than revenue optimization, where people seek care at the first sign of problems rather than waiting until conditions become critical, where medical professionals are rewarded for keeping populations healthy rather than maximizing billable procedures, where innovation focuses on prevention and cure rather than chronic disease management that generates ongoing revenue, where nobody faces the choice between life-saving treatment and financial survival. This isn't naive idealism. This is literally how healthcare functions in much of the developed world. The question isn't whether it's possible, it's whether we have the collective will to demand it and the political courage to implement it against the fierce resistance of those profiting from the current arrangement. What we're really talking about here is a fundamental question about what kind of society we want to be. Do we accept a world where human bodies are treated as collateral in financial transactions, where suffering is monetized and survival is commodified? Or do we insist that some things are too important, too fundamental to human dignity, to be subjected to pure profit maximization? Your body is not a financial instrument. Your health is not an investment opportunity. Your life is not a revenue stream to be optimized for someone else's quarterly returns. And the more people who truly understand that, who reject the normalized exploitation, who demand alternatives and support resistance, the closer we get to actually dismantling this machinery of extraction and building something that serves human well-being rather than financial accumulation. If you made it this far, you're not just a viewer, you're part of something bigger. Drop a comment and say it with me. Healthcare is a human right. If you made it all the way to the end of this video, you're exactly the kind of person this channel exists for. Most people click away when things get uncomfortable. You stayed. You're willing to sit with uncomfortable truths, to look past the sanitized narratives we're fed, and to understand the actual mechanics of power and money in our world. That matters more than you might realize, because knowledge like this only creates change when it moves beyond individual awareness and becomes part of a broader collective understanding. And look, I know you've been sitting here for a while absorbing some pretty heavy material, so let me know you made it to the end. Drop a comment that says, "I see what's really happening," so I know this message landed with you. Reading those comments genuinely matters because it tells me what's connecting with people, what questions still need answering, what topics we should dig into next. You're not just watching content, you're part of a community that's collectively building a more accurate picture of how the world actually works versus how we're told it works. If this video shifted your perspective or gave you language to describe something you'd been sensing but couldn't quite articulate, throw a like on it. It helps other people find this content when they're searching for real answers instead of comfortable lies. The algorithm doesn't care about truth. It cares about engagement. So every like pushes this information towards someone who needs to hear it. If you want to keep exploring how financial systems shape our lives in ways most people never see, hit that subscribe button. This channel is dedicated to pulling back the curtain on the architecture of corruption, examining how elite interests operate, and connecting dots that powerful people would prefer remain scattered and invisible. And listen, this conversation doesn't end here. We've uncovered how healthcare became a financial extraction machine, but this same playbook shows up everywhere once you know what to look for. There's a video right here that exposes how Wall Street launders fraud through the legal system and why almost no one ever goes to prison for it. Same patterns, same players, different mask. Click over and keep going with me, because the more you understand about these systems, the harder they are to ignore and the clearer the path toward actual change becomes. I'll see you there.